Good morning, everyone. Respected Dais and Padma Shri, Dr.Omesh Kumar Bharati, sir. It's an honor to be with you today, and we are looking forward for your words of wisdom to our pharmacy students. Let me introduce our institute, Samarth Rural Educational Institute, established in 2007 through the visionary efforts of Honorable Shri Vasant Raoji Shelke, Shri Vivek Shelke, and Shri Vallabh Shelke, is dedicated to providing quality education to underprivileged and talented students from rural and tribal areas at an affordable cost. Starting with just 50 students, the institute has grown into a hub of learning, currently educating over 6,200 students with the support of 550 dedicated staff members across its 14 educational campuses. These campuses offer diverse disciplines including management, engineering, polytechnic, pharmacy, computer science, law college, ITI, junior college, paramedical, nursing, Ayurvedic studies, along with CBSE, which we call Gurukul Primary School. With a strong focus on bridging the gap between theoretical knowledge and practical skills, the Institute collaborates with leading multinational companies to offer industry aligned training programs through its cultural initiatives, community outreach under the Unnat Bharat Abhiyan, and partnership with esteemed organizations, national as well as foreign. Samarth Rural Educational Institute nurtures the holistic development of students, accredited by National Accreditation Assessment Cell and National Board of Accreditation and recognized by prestigious governing bodies. Samartha Rural Educational Institutes continues to empower rural and tribal students, shaping them into skilled professional ready to meet the demands of the modern world. Now, I would like to emphasize on our research, innovation, and internationalization cell activities. We started last year, sir. We are very new, but we have achieved, I can say, quite good number of things. Like this is our journal. Okay, we publish around 200 research papers, out of which the Pharmacy College of Samartha College of Pharmacy and Institute of Pharmacy. We have two institutes for pharmacy. They have published 115 research paper. These research papers are like, some of them are published by the faculties, some review papers, case studies, statistical analysis, qualitative, quantitative. We are just new, so we are going towards Scopus, Web of Science. Then also we usually conduct international conferences. Okay, we recently signed MOU with Shinawatra University, which is based in Thailand. Then we have signed MOU with ISTAR, International Society of Administrators, Teachers and Researchers from Thailand. Then we have signed MOU with Padma Academy from Vietnam. And there are 17 to 18 MOUs in process with the Philippine-based state universities or private universities. So this is our internationalization activities. We have designed 3 courses. One is on research methodology, leadership, innovation, entrepreneurship, and which we going to sell in those universities. So that way we can do student exchange. Then our faculties, they are going to give their lectures in abroad. So these are some internationalization activities. Along with that, we are working on patents also. Recently, we have got German patent for system for generating electricity through moving vehicle. So one of our student, the Vivek sir's son, Samartha, he has developed a prototype, and then along with his idea and our team support, our honorable Vivek sir and Vallabh sir support, we develop a proper this thing model, and we applied for German patent, and recently last month we have got German patent. Then 2 more projects which we are going to propose for patent now, because one of them is about agricultural research. The 2 students from engineering, they have prepared a website and application also to assess the quality of agricultural crops, and that project has got awarded nationally also. a state also by Agastya Foundation and so many organizations. In Symbiosis also last week they got first prize. So now our plan is to do that projects towards the patent. Then one more project which we are filing for patent is about agriculture, because these students are from agriculture background. They are farmers childs. So we are focusing on more on patents, research papers, and I am personally taking some sessions, hands-on training sessions, or some sessions on how to write research papers, how to write effectively research papers using artificial intelligence, how we can use artificial intelligence ethically and responsibly in academic paper writing. So these are some initiatives. Along with that, we every month we organize faculty development program. We train as I have so much of exposure from foreign universities. I've been into foreign for so many years. So I am imbibing my things which I gain from Dr. Mashelkar and from the all foreign culture to our faculty, so that they can upgrade, because this is the era of artificial intelligence. We need to update and upgrade every day. So these are some initiatives, and we look forward to your speech, and please suggest something which we can do here for the betterment of society, for the betterment of our Samarth Rural Educational Institute. With this, thank you so much. On dog-mediated human rabies in the WHO Southeast Asia region for 3 years term from January 2023 to August 2025. He has implemented WHO New Rabies Guidelines 2018 in the state of Himachal Pradesh, only state in India to do so. His paper accepted for publication as only evidence from India that may help change Indian guidelines on rabies prophylaxis in tune with WHO Guidelines 2018. He has been included in the WHO's panel of experts for strategic plan for control and prevention of snake bite and worming. He is also expert member of National Technical Advisory Committee, India on rabies under National Rabies Control Program since February 10, 2023. He also an expert member of National Rabies PAPE Guideline 2019 and National Snake Bite Management Guidelines India. He is also a member for the core committee to finalize the draft National Action Plan for Rabies Elimination in India. Also working on many experiments for low-cost rabies prophylaxis and animal rabies vaccination. And he has extensively working on alternative strategies to make India human rabies free by 2030. So he's on mission. He has supervised as field supervisor for student doing MPH scholar implementation research from universities abroad on WHO TDR Special Postgraduate Program of Implementation Research on Tropical Disease Rabies. Also cost effectiveness, he's working on cost effectiveness of rabies prep in India. His thesis paper published and is the evidence for India to include rabies vaccine in UIP. And the very prestigious and proud moment that he has been awarded Padma Shri, which is India's highest forced civilian honor in medicine rabies by Honorable President, former President of India on March 16, 2019. And also he has extensively published papers, and he is on editorial board member on rabies and related topics, accessible at his ResearchGate profile. So you can just Google his name, you will get his Google Scholar and ResearchGate profile. You can read his work, his papers, and it's an honor for Samarth Rural Educational Institute to be with him today. And yes, I welcome you, sir, and thank you.
प्रिन्सिपल डॉक्टर प्रतीक आणि सगळ्या विद्यार्थी मित्रांना थोडक्यात मी जास्त काही बोलणार नाही, वेळ घेणार नाही, त्यांना वेळ कमी आहे. डॉक्टर ओमेश भारती हे माझे मित्र आहेत आणि आमची मैत्री अशीच आम्ही ज्यावेळी इंटरनॅशनल कॉन्फरन्सला जातो त्याच्यातून झालेली आहे. त्यांची ओळख तुम्हाला इंग्रजीतून सांगितली, पण खरी ओळख मी त्यांची तुम्हाला मराठीतून सांगणार आहे मुद्दाम. आपल्याला पूर्वी रेबीज होऊ नये म्हणून प्रॉफिलॅक्टिकली इंजेक्शन द्यायचे. तुम्हाला माहिती आहे कुत्रा मांजर चावल्यानंतर काय द्यायचे, काय आजार होतो, रेबीज, आणि तो होऊ नये म्हणून आपण अँटी रेबीज इंजेक्शन आणि अँटी रेबीज इम्युनोग्लोबुलिन देतो, बरोबर ना. त्याचे डोस वगैरे तुम्हाला माहीत नसेल डॉक्टर नसल्यामुळं, परंतु त्यातलं ते रेबीज इम्युनोग्लोबुलिन इंजेक्शन आहे, ती द्यायची पद्धत खूप वेगळी होती पूर्वी. ते आपल्याला मायक्रोग्रॅम पर वेट प्रमाणे डोस करून ते आपण इंट्रामस्क्युलरली दोन्ही दंडावर द्यायचं. कुणी घेतलं पण असेल, कुणाला कुत्रा चावला होता का? नाही. तर त्याचा डोस तो आपल्याला दंडावर द्यायला लागायचा. परंतु त्यांनी असं एक संशोधन केलेलं आहे की जिथं जखमा झाल्या तिथंच फक्त स्प्रेड केल्यानंतर जर ते इंजेक्शन दिलं, वरचेवर स्प्रेड केलं, तरीसुद्धा रेबीज होत नाही. रेबीज प्रॉफिलॅक्सिस 100% होतं. हे संशोधन त्यांनी लावलेलं आहे आणि त्याच्यासाठी त्यांनी खूप त्रास घेतलेला आहे. ते पण आपल्यासारख्या सर्वसामान्य हिमाचल प्रदेशमधल्या एका खेड्यातले आहेत आणि तिथून जाऊन त्यांनी शिक्षण घेतलं. त्याच्यानंतर एपिडेमॉलॉजिस्ट याच्यात गव्हर्नमेंटमध्ये सर्व्हिस करत असताना त्यांनी कुठलीही शासकीय किंवा कोणती मदत नसताना एक रिसर्च अँगल ठेवून हे संशोधन केलेलं आहे आणि सुरुवातीला त्याची दखल जागतिक आरोग्य संघटनेनं घेतली आणि नंतर आपल्या भारत सरकारनं घेतली. तर ते इंजेक्शनचा एवढा परिणाम झाला आहे की ते पूर्वी द्यायला 30 ते 35,000 रुपये खर्च यायचा. जर कुणाला कुत्रा चावला तर त्याचे डोस एवढं महाग होते ते की ते 35,000 रुपये खर्च यायचा. आता ते इंजेक्शन फक्त 350 रुपयात त्या रुग्णाला दिलं तर त्याचं ते प्रॉफिलॅक्सिस होतं रेबीजपासून. म्हणजे खूप महत्त्वाचा शोध लागला आहे आणि गरीब लोकांना, करोडो गरीब लोकांना याचा फायदा झालेला आहे आणि म्हणून त्याची केंद्र शासनाने दखल दिलेली. आणि इथं त्यांना आणण्याचा उद्देश तोच आहे की तुम्हीसुद्धा शिक्षण घेत असताना तुमच्या मनात काही जरी ॲक्टिव्हिटी ठेवली, शेवटी आपल्याला एज्युकेशन, शिक्षण कशासाठी घ्यायचं आहे की समाजासाठी काहीतरी चांगलं करण्यासाठी, समाजातली लोकांच्या वेदना कमी करण्यासाठी आणि त्यासाठी तुमच्यामध्ये सुद्धा तो अँगल कुठेतरी डेव्हलप व्हावा म्हणून त्यांना इथं बोलवण्याचा आजचा उद्देश आहे. आणि सगळ्यात महत्त्वाचं म्हणजे त्यांना पुण्यात BJ मेडिकल कॉलेज जे आहे, मेडिकल कॉलेज, त्यांच्या रिसर्च सोसायटीमध्ये कीनोट स्पीकर म्हणून बोलवलेलं आहे आणि म्हणून योगायोगाने ते आपल्याकडे आलेले आहेत. एवढ्या मोठ्या संस्थेत, आपल्या देशातली एक ती नावाजलेली संस्था आहे. दुसरं व्याख्यान त्यांचं परवा नॅशनल इन्स्टिट्यूट ऑफ व्हायरॉलॉजीमध्ये होणार आहे, सगळ्या जे रिसर्च ऑफिसर्स आहेत त्यांच्यासाठी. हे दोन्ही एवढे महत्त्वाचे कार्यक्रम असताना आपण त्यांना तुमच्यासाठी इथं आज निमंत्रण दिलेलं आहे. तुम्ही त्यांना शांतपणे ऐकून घ्याल अशी अपेक्षा आहे आणि त्याच्यापासून काहीतरी इन्स्पिरेशन घेऊन तुम्हीसुद्धा तुमच्या आयुष्यात काहीतरी चांगलं करावं. तर तुम्हाला मुनगेकर सर मिळालेलेच आहेत, त्यामुळं काही प्रश्न नाही गायडन्ससाठी. तर इट इज व्हेरी गुड. आपल्याला आजचा हे आहे, तर सर्वांनी या व्याख्यानाचा फायदा घ्यावा एवढी विनंती करतो आणि थांबतो. धन्यवाद.
Good morning. Should I talk in English or in Hindi? Hindi. Yeah. Hindi, English. So thank you for inviting me here. I'm very happy with students because at some time I was a student like you. तो हमारे कॉलेज में कोई लोग आते थे लेक्चर देने, हम बड़े इम्प्रेस होते थे कि कभी हम भी लेक्चर दें. बट फॉर दैट यू हैव टू वर्क वेरी वेरी हार्ड. ओके, बिकॉज लेट मी टेल यू, आई मस्ट बी वन ऑफ द यंगेस्ट डॉक्टर टू गेट Padma Shri at the age of just for 50 years. So this is just hard work and I think my desire to help poor people, that worked. Sir said research methodology. Being a pharmacy students, you should be well versed with the research methodology because the power of publication, nobody understand better than better than me. Because when my first paper was published, that was my first on the rabies, and that was read by somebody in Geneva, and they sent me the email. The doctor, you are doing a very good job and WHO is looking for a doctor like that. You generate more data. So then I shared the raw data with the WHO and they examined it 360 degree. I mean, if there could have been any tampering with the data, the credit could not have gone to me. So first lesson is power of publication. Second lesson is critical analysis of the data. If you tamper with the data, people would catch you. There are so many, like AI, there are so many other softwares that can capture that some tampering has been done. So be honest in publication, be honest in your data publication, data gathering, whatever it is coming. It is not coming inconsistently coming, okay, you record it. Okay, so that is my advice to you, that don't try to uh, be clever in data tampering. People are more clever than you. So be honest, gather your data honestly, publish your paper in a honest way, and whatever results are coming in that way. So today I'm little bit touching what I did. It's a big long story, but I would be cutting it short because what I did was, because poor people from village could not afford this dog bite treatment. So they used to go to some tantric, some local person, some holy water, some holy something. So local treatment, not to the hospital, because hospital it was very costly. So what I did, there are, dog bite में कितने इंजेक्शन लगते हैं? 14. वो तो वैक्सीन लगी है, और क्या लगता है? हाथ खड़ा करो. और कौन सा इंजेक्शन लगता है? रेबीज इम्यूनोग्लोबुलिन, दैट इज रेडीमेड एंटीबॉडी. ओके, तो कोई डॉग बाइट हो जाए तो पहला काम क्या करना है? व्हाट इज द फर्स्ट थिंग आफ्टर ए डॉग बाइट? फर्स्ट एड. कभी कुत्ते ने काटा है? डॉग बाइट हुआ कभी? नहीं हुआ. डॉग शरीफ है क्या यहाँ के? काटते नहीं है. अरे डॉग बाइट के बाद पहली फर्स्ट एड है वुंड वॉशिंग. वॉशिंग द वुंड विद सोप एंड वाटर. ठीक है, एंड देन एप्लीकेशन ऑफ एंटीसेप्टिक. तो दैट इज द फर्स्ट एड. वॉशिंग द वुंड विद सोप एंड वाटर अंडर रनिंग वाटर, एंड देन एप्लीकेशन ऑफ एंटीसेप्टिक. So that would save you 60% of rabies. 60%. So what I did was, vaccine used to be given intramuscular. I stopped giving intramuscular. I started giving it intradermal. Intradermal क्या होता है? हाँ, स्किन में. और कैसे पता लगता है कि इंट्राडर्मल इंजेक्शन इंट्राडर्मल लग गया? उसका निशानी क्या है? कैसे पता लगेगा इंट्राडर्मल लग गया? कोई एनीबॉडी? ब्लैब. ब्लैब स्किन उठेगी ना ऊपर को, एक ब्लैब बनेगा ना, तो दैट शुड बी 3 to 4 mm साइज. तो उससे पता लगेगा कि इंट्राडर्मल ठीक लग गया. उससे कम साइज का हो तो इंट्राडर्मल नहीं लगा, दोबारा लगाओ. ठीक है, ठीक है. तो उसको मैंने वैक्सीन को इंट्रामस्कुलर से इंट्राडर्मल कर दिया. ठीक है, तो उससे क्या हुआ कि वैक्सीन की कीमत, डोज कम हो गया तो वैक्सीन की कीमत 5 गुना कम होगी. और जो इम्यूनोग्लोबुलिन लगती थी वो वजन के हिसाब से कैलकुलेट होती थी, उसको घाव में लगाते थे, बाकी हम इंट्रामस्कुलर लगाते थे. तो मैंने क्या किया कि इंट्रामस्कुलर लगानी बंद कर दी. ऐसे नहीं की बंद, मेरी मर्जी आई तो बंद कर दी. मैंने कहा जब वायरस ब्लड में जाता ही नहीं है तो इंट्रामस्कुलर क्यों दे रहे हैं? तो जो कम से कम ये मानो कि 10 ml जो लगती थी इम्यूनोग्लोबुलिन, वो अब 0.5 ml लगती है सिर्फ घाव में लगाना. ठीक है, तो ये पहली बार दुनिया में हुआ कि किसी ने रूट चेंज किया और उसकी कीमत जो है 35,000 से 350 रुपये रहेगी, 100 गुना कम होगी, जस्ट बाई चेंजिंग द रूट ऑफ द वैक्सीन एंड इम्यूनोग्लोबुलिन्स. देयर आर वेरी वेरी फ्यू एग्जाम्पल्स और मे बी नो एग्जाम्पल वेयर यू हैव चेंज द रूट ऑफ द वैक्सीन एंड दैट ब्रॉट डाउन द कॉस्ट ऑफ द मेडिसिन. ठीक है, तो फिर ये पब्लिकेशन हुआ, फिर WHO ने बोला, फिर हमने और पब्लिकेशन किया, फिर हमने और एविडेंस इकट्ठा किया. तो जो एक्सपर्ट कमेटी थी उसने कहा कि ये दुनिया का सबसे सस्ता इलाज है, इट शुड बी रिकमेंडेड ग्लोबली, एंड दे रिकमेंडेड माई वर्क डन इन ए स्मॉल डिस्ट्रिक्ट हॉस्पिटल ग्लोबली. ठीक है, तो ऐसा कुछ नहीं है, कोई भी इंस्टीट्यूट, कोई भी आदमी कुछ भी कर सकता है ज़िंदगी में, लेकिन उसको मेहनत करनी पड़ेगी. तो हमें मुझे बताना पड़ा कि मसल में देने की ज़रूरत नहीं है, उसके लिए पढ़ना पड़ा, उसके लिए एविडेंस क्रिएट करना पड़ा. So that is a small story. You can go to the Google and rightly said, you can see my lectures and all the papers, everything. My songs also. Sometimes I sing also. तुम में से गाते हैं कोई? पोइट्री लिखते हैं? नहीं, कुछ नहीं, पढ़ाई करते सिर्फ। तो ये बात ये थी। दूसरी बात मैं ये कहना चाहता हूँ सर, डॉक्टर पत्री, डॉक्टर, हाँ प्रतीक, हम वहाँ कहाँ गए थे? महाशंकर? हैं? नहीं, हम कहाँ गए थे मंदिर में? नहीं, ऊपर भीमा शंकर। हम भीमा शंकर गए तो मैंने देखा सर कि वहाँ पे बड़ी सारी आयुर्वेदिक मेडिसिन लेके वो लोग बैठे हैं, ठीक है। तो मेरा एक सुझाव रहेगा, जो आपने कहा कि हमें बताएं कुछ, कि वो उन दवाइयों का एनालिसिस करो, उनका एनालिसिस करो, उनमें साइंटिफिकली देखो उसमें कितना कंटेंट है, कितना एक्टिव इंग्रेडिएंट्स हैं, कौन सा एक्टिव इंग्रेडिएंट। सरने का एक सर्प की ट्रीटमेंट का भी है उसमें। तो ऐसी जो आपके आसपास जो उस तरह की मेडिसिनल हर्ब्स हैं, उसका एक डॉक्यूमेंट पूरा प्रिपेयर कर सकते हैं। एक एक बच्चे को टास्क दे सकते हैं कि तू इस पे लिखेगा, तो इस पे लिखेगा। तो विद फोटोग्राफ्स वी कैन क्रिएट ए रिकॉर्ड ऑफ द हर्बल मेडिसिन ऑफ योर एरिया और महाराष्ट्र और योर whatever area is, you can prepare a documentary, and secondly you can analyze them in a scientific way. हम भी कर रहे हैं, हमारे यहाँ भी मेडिसिनल हर्ब होती हैं। एक हर्ब होती है स्वर्षीय चराइता। सो हमने उसका स्नेक बाइट के लिए हर्बल स्प्रे सर ने, डॉक्टर रावत ने यूज़ किया है उसको। तो अभी हम उसको और रिफाइन करेंगे। ऐसे ही हम उसके एक उस हर्बल ड्रग की हम एक एंटी माइक्रोबियल रेजिस्टेंट ड्रग्स के लिए एक ड्रग बना रहे हैं, ताकि उसको वो पीजीआई के साथ कोलैबोरेशन में बना रहे हैं। तो उसके अच्छे प्रॉमिसिंग रिजल्ट आएंगे। जैसे सूडोमोनास ऑरियस है जो रेजिस्टेंट है, तो उसके लिए कोई नई ड्रग नहीं मिल रही है, तो हम कोशिश कर रहे हैं कि उस हर्बल प्लांट से हम उस ड्रग को बनाएं। तो वी आर इन कोलैबोरेशन विद पीजीआई चंडीगढ़। तो ऐसे ऐसे हम सोच सकते हैं नए आइडियाज़ की, कैसे जो एग्जिस्टिंग पूल ऑफ ड्रग्स है, क्योंकि नई ड्रग्स आ नहीं रही हैं बड़े टाइम से, और जो एग्जिस्टिंग बैक्टीरिया हैं वो बड़ी जल्दी दे आर फास्ट टर्निंग इनटू एंटी माइक्रोबियल रेजिस्टेंस। So now the major work of the pharmacy students is to find drugs that are new and that can overcome the resistance of the pathogens. वो इसलिए important है for a doctor. If I give some drug and antibiotic and it is not working, the patient would die. We have seen people dying, actually dying. They didn't respond to the higher antibiotics and they died. So future is to overcome this future problem. The future of medicine is developing new drugs and injections, and the major resource is herbal, because that is there already. So we need to make cataloging of the herbal plants, and then we need to extract the active ingredients to make medicines that are resistant, that are working on anti-resistant resistant bacteria. So that is the thing that I think you can plan. Human being का तो बहुत मुश्किल है। So I was posted as a doctor like you are here. Like I was a junior doctor in my hospitals. I saw that patients are not able to purchase the medicines and they died because they could not purchase the vaccine, rabies vaccine. He was a driver earning 3,000 rupees per month on a private taxi, and he was written rabies vaccine. And the rabies vaccine was costing 2,250 rupees. So he's earning 3,000, he can't purchase. He went back and he died of rabies. So at that point, I started thinking if we can reduce the cost of this vaccine. So I read a lot of literature. If there is anything that we can reduce the vaccine cost. So I got some of the leads that yes, we can do it. But nobody was doing. So I went to my chief medical officer, being a junior doctor, sir, if we do like that, if we give intradermal, we can reduce the cost and it would be affordable to the patients. So he started scolding me. He said, you illiterate person telling me what to do, being a chief medical officer. So I was not illiterate, I was MBBS doctor working there. So illiterate means I was not PG. I have not done post-graduation. So every time I used to go to him, sir, see Harrison, see this book, see that. So he would kick me out. He's saying, no, you do PG and then come to my room. Don't come to my room without doing PG. So I was at that time, sir, 43. बूढ़ा हो गया था, बूढ़ा कहाँ जाएगा PG करूँ? So still I thought I have to do PG, only then this would happen. I went to do my post-graduation in Chennai National Institute of Epidemiology, and then I did my post-graduation in epidemiology. Then I came back. Then he offered me a chair. Yes, now you are qualified to talk to me. Because he was a medical expert and I was a simple MBBS. But then he listened to me. Then he said, see, look, doctor, we can't allow you this because PGI Chandigarh is not doing, AIMS Delhi is not doing, no big institutions are doing it. So we won't allow you to do this. I said, okay. So one fine day, what happened? The vaccine was not available. So what to do? Only few vials were there. People would die if we don't give the treatment. So he called me again. He said, tell me what you were saying, that how can small vaccine be save lives. So I told him like we should shift to intradermal. That's how intradermal started. And then we documented, we published it, we lot of things. And then it was made free to all. So that is the vaccine story. Regarding immunoglobulin, again a time came when people were getting vaccine but not the immunoglobulin. And they died despite getting the vaccine. So I again went to the director of health and I told him, people are dying, what to do? He said, what can you do? I told him, out of reading entire literature, I can say only wound infiltration is important. Only giving the immunoglobulin into the wound is important. Giving intramuscular is not of any significance because rabies virus does not go to the blood. So he said, I don't know, you talk to WHO. I told him, oh, no, how can I talk to WHO? I don't know anybody. You talk being a director. He said, no. So after that, I tried to find out some sources and then I was in touch with some of their people, advisors. And then I started a trial in my clinic. Because I could start because it was not available outside. If it could have been available outside, I could not have started. So because the excuse was it is not available outside anywhere in the country. So we started giving only wound infiltration. That's how that was published and that was read by WHO. WHO people sent me the email and then their meeting, their expert group, then raw data was examined and everything was done. And then they accepted and changed the guidelines and made it, this guideline is a global. That everybody would follow this low cost solution that was done by me in my hospital. Thalassemia, I'm working on epilepsy, so many blood banking, my thesis on blood banking. So you can do so many things at one time. You never know which thing would succeed. It is just a game. You are working on 10 things, but ultimately your one thing is recognized, and others are not recognized. So you never know where you would get a recognition and where you would not. It all depends. Thank you.